In the latest AP polling, Trump is minus 36 on the economy. 31% of the country approves of Trump on the economy. 67% disapproves. So Trump on the economy is underwater by 36 points. On healthcare, it's even worse. He's underwater by 40 points. And that poll ended before today, which is the deadline for people to sign up for their health plans under the ACA, which is tens of millions of people in this country. And those plans, the prices of those plans, the premium costs are skyrocketing in price because of what Trump and the Republicans did in his so-called big, beautiful bill. What they did to destroy healthcare premiums in terms of how expensive they are, what they did, that overt policy change they made that costs everybody's health insurance premiums to go through the roof, that starts hitting people officially today. Trump and the Republicans caused it. They have not been able to fix it. And Trump is already 40 points underwater on healthcare even before that starts.
29% approve of how President Trump is handling healthcare. 69% disapprove, a minus 40 margin. And when numbers get that lopsided on an issue this personal, it usually means one thing: people aren't answering a policy quiz, they're answering from their kitchen table, staring at a bill they can't explain. So tonight I want to slow this down, cut through the talking points, and ask the question Americans actually live with. When your premiums jump, when your deductible resets, when a routine visit turns into a four-figure surprise, who do you hold responsible, and what would it take to win your trust back? Stay with me all the way through, because the most important part of this story isn't the poll number. It's what's underneath it. The fear that one bad diagnosis can wipe out years of savings. And the frustration that even when you have insurance, you still don't know what anything will cost until after it's too late. Those 2969 numbers come from a December AP NORC poll, and they're not just another approval statistic. They're a warning light, because healthcare is one of the few issues that can unite people who agree on almost nothing else. Conservatives, liberals, independents, everybody understands what it feels like to get trapped in a system that speaks in codes, not answers. Now here's the part I want you to think about, and I want you to comment it honestly. When you hear healthcare, what hits you first? Cost, access, or trust? Cost is the obvious one, and it's the one Americans keep naming. You can hear it in the everyday decisions people quietly make: splitting pills, delaying a checkup, choosing between dental work and rent, ignoring a pain because I can't afford the scan. And if you've ever done that, you're not alone. Polling this year has shown rising concern that the U.S. system is in serious trouble, and people keep circling back to affordability. Access is the second. It's the rural hospital that closes and turns a quick ER trip into a 2-hour drive. It's the specialist appointment that takes months. It's the therapy visit that costs so much you start calculating your mental health like a luxury item. But trust is the quiet killer. Trust is when you stop believing the system will catch you when you fall. And once trust breaks, approval ratings don't just dip, they collapse. So why is Trump getting hammered on healthcare in particular, even while opinions on other issues can move up and down? Because healthcare punishes vagueness. In healthcare, people don't want vibes. They want a number, they want a date. They want to know, how much will I pay, what is covered, what happens if I lose my job, what happens if my kid gets sick. And if leadership can't give clear answers, the system gets blamed, and the person in charge gets blamed along with it. And that brings us to the pressure point that keeps showing up again and again: insurance affordability, especially for people who buy coverage on their own. There's a major fight in Washington over the Enhanced Affordable Care Act premium tax credits, subsidies that help lower monthly premiums for millions of people. A large majority of the public says Congress should extend them rather than let them expire. And reporting this month has pointed to the real-world stakes if those subsidies end. Premiums can jump sharply for families who are already stretched thin. Now here's where it gets political, because whether you like Trump or you hate Trump, healthcare is one of those issues where people don't grade on intention. They grade on outcome. If you're a working parent and your premium doubles, you don't care which party wrote which clause in which bill 10 years ago. You care that it happened, and you care who is in charge when it happens. That's why the 2969 number matters. It suggests this isn't just partisan dislike. It's a broad perception that the country is not being protected from the most predictable threat to household stability: medical cost shock. And I want to hear from you, because your comment section is where the real story lives. Have your costs gone up this year? Premiums, copays, prescriptions? If you're comfortable, say what changed. And if you're not comfortable sharing numbers, just tell me whether it got better, worse, or stayed the same. Now let's talk about something Americans rarely say out loud, but everybody knows. Healthcare is not one system. It's 3 systems stacked on top of each other. One system for people with strong employer coverage. a second system for people on Medicare or Medicaid who are protected in some ways but still face gaps and confusion, and a third system for people who are self-employed, gig workers between jobs, or buying on the marketplace where policy changes can hit like a storm. When presidents talk about healthcare, they often talk like the country has one uniform experience. It doesn't. And when a policy shift happens, it can feel like the government is helping one group while another group is left to drown. That's how you get anger. That's how you get distrust. That's how you get a -40 margin. Now, to be fair, no president controls healthcare the way they control a military order. Healthcare is a web: Congress, states, insurers, employers, hospital systems, drug manufacturers. But presidents do shape the direction through regulations, priorities, messaging, what they fight for, and what they let expire. So the question becomes, what do Americans believe Trump is doing or not doing that produces this level of disapproval? Some of it is the perception that the administration and Congress have focused more on political fights than on concrete cost relief. Some of it is the fear that subsidies and protections people rely on could weaken. And some of it is simply the lived experience of inflation meeting medicine, where everything got more expensive is already painful, but my health got more expensive feels like a betrayal. And if you're thinking, okay, but what should be done? This is where the story gets real. Americans want a few simple things, and they don't sound radical. They want price transparency that actually works. They want drug prices that don't feel like ransom. They want fewer surprise bills. They want coverage that doesn't disappear when life changes. And they want the sense that the system is built for patients, not for paperwork. So here's a thought experiment I want you to answer. If you could force Washington to pass just one health care change next month, only one, what would it be? Lower prescription drug prices, cap deductibles, extend the ACA subsidies permanently. Protect people with pre-existing conditions in a way that can't be undone, stop surprise billing loopholes, or something else entirely. Write it in the comments. One change. If you can't pick one, pick the one that would help your family most. Now let me take you into the emotional core of this poll, because polls don't just measure opinions, they measure pain. Imagine a 58-year-old who isn't old enough for Medicare, whose employer coverage got worse, whose spouse has a chronic condition, whose savings are thin, and whose premium is climbing. That person is not thinking about party labels. They're thinking about survival. Or imagine a 27-year-old freelancer who earns decent money one month and barely any the next. When they hear about subsidies possibly expiring, they don't hear legislation. They hear my plan might become impossible. Or imagine a family that did everything right. They got insured, they used in-network care, they followed the rules, and they still got hit with a bill that feels like a trap. That's the America behind 2969. And when trust collapses in healthcare, it spills into everything. People stop going to doctors, conditions worsen, emergency rooms fill up, costs rise further. It becomes a vicious cycle, and voters blame whoever is in charge. Now I want to address something carefully, because this is where the conversation gets manipulated. When people hear Trump is underwater on healthcare, some commentators instantly turn it into a personality fight. They make it about scandal or slogans. But the smarter way to look at it is this: healthcare is the issue where performance is tested in the most personal way possible. You can argue about foreign policy and still sleep at night. You can argue about abstract economic numbers and still eat dinner. But healthcare hits the body. Healthcare hits your child. Healthcare hits your mother. Healthcare hits your bank account. So if you're a viewer who supports Trump overall, this is the question you should be asking: what would the administration need to do on healthcare to earn your approval? And if you're a viewer who opposes Trump, this is the question you should be asking: what would Democrats actually pass, specifically, that would lower costs without creating new chaos? Because the truth is, Americans have been promised healthcare fixes by both parties for years, and the reason cynicism is so strong is that the system keeps getting more expensive anyway. Now let's talk about what happens next, because this story is moving into a high-stakes window. Millions of Americans are staring at the future of ACA subsidies and the cost of marketplace coverage. If Washington fails to extend relief, families will feel it fast. And when families feel it fast, polls like 2969 don't stay stable, they get worse. And that raises the biggest political question of all: will health care become the defining issue of the 2026 midterms, not because people suddenly fell in love with policy debates, but because the bill arrived? This is where I want you to stay with me, because the next part of this story, whenever you look away, will be fought with messaging. One side will say this is the president's failure. The other side will say this is Congress or it's states or it's the legacy system. But the public usually responds to one reality: who was in charge when my life got harder? That's the brutal simplicity of democratic accountability. So let me close this segment with a question that matters more than approval ratings. If you could sit across from the president for 60 seconds, no shouting, no spin, what would you say about health care? Would you talk about premiums? Would you talk about drug prices? Would you tell a story about a family member, or would you ask a direct question? Do you have a plan that lowers costs in the next 12 months, yes or no? Drop your answer in the comments because I'm telling you right now, healthcare is the issue where politicians fear the comment section the most because the comment section is where the receipts live. And if you're still listening, here's your final assignment, not for me, for you. Pick one number that defines your healthcare experience. Your monthly premium, your deductible, your most expensive prescription, your last surprise bill, or your out-of-pocket maximum. Just pick one and remember it. Because that's the number that decides whether 2969 is just a poll or a warning siren that America is done being patient.